and they went on strike to get them. As their parent union says, it hasn't always been easy, but nothing worth doing is. In fact, the hottest fires forge the hardest steel. New Jersey's HPAE, representing 14,000 nurses, social workers, therapists, technicians, medical researchers, and other healthcare professionals in hospitals, nursing homes, home care agencies, blood banks, and university research facilities in both New Jersey and the Philadelphia area. HPAE fights for safe staffing because it's the right thing to do for healthcare workers, for patients, and for our communities. They are proud to support WBAI and Pacifica's labor coverage. And of course, Mike Quill's Transport Workers of America.
The Transport Workers Union fights the bosses for our 155,000 members across the economic spectrum. Airlines, mass transit, rail, school buses, bike share, tourism, university and utilities, even Central Park Horse Carriage drivers. I'm John Samuelson, International President of the Transport Workers Union. If you want a strong voice at the workplace, if you want to improve your life, join us. We are the TWU, America's Fight Back Union.
All right, with us now on our second half of the show, Julie Back, who also runs her husband Steve's St. Louis, Missouri-based rheumatology practice and is also a healthcare consumer advocate that does battle with Medicare Advantage plans every single day. She's on Central Time, so Julie, thanks for getting up so early. I appreciate that. Thanks for being here with us.
Absolutely. It's my pleasure. I will get up at the crack of dawn to support the patients over Medicare Disadvantage.
Thank you so much. So I understand you and Marianne have been allies in this fight against Medicare Advantage for a while. Talk about what it's like to be in the doctor's office part of this equation, and what Medicare Advantage, what the hurdles that Medicare Advantage puts up while you're trying to care for patients.
Sure. So I'm the practice manager of a rheumatology practice. So rheumatology offices deal with arthritis, lupus, ankylosing spondylitis, rheumatoid arthritis, chronic diseases. So we're not curing any diseases in our office. We are managing them. And there's a giant target on a rheumatologist's back because of the expensive medicines we prescribe. So if our patients have a Medicare Disadvantage plan, they have traded in their choices of therapy plans, physicians, for essentially a plastic shoehorn. All of these there are over 400 Medicare Disadvantage plans in Missouri alone, right? And so seniors get bamboozled into doing this, and they give away their rights. So anyone in a rheumatology office is going to need good care. It's not Medicare Advantage unless you have your out-of-pocket every year.
Julie, tell us how you're using the power of social media to help your patients.
So we have been on social media for about 4 years on Twitter. And if we use the normal appeals, less than 1% of the physicians appeal an insurance decision. My office, we appeal everything because Dr. Bach and his clinical team will not make a non-medical switch, won't do white bag medicine. These are all levers used by the insurance companies to funnel everyone into one-size-fits-all plans, and rheumatology patients are never one-size-fits-all. They're not even close to one-size-fits-most. So we have to look at each individual patient. In our office, most of our patients have, on average, 6 to 15 chronic diagnoses. These are really medically complex patients, and it's no good to be one-size-fits-all. The Medicare Disadvantage issue... Go ahead.
This sounds like you get a lot of denials then.
Absolutely. We absolutely get a lot of denials because the insurance company wants to capture all of those expensive medicines and mandate them to their pharmacy benefit manager. So if you have traditional Medicare and a supplemental plan, you don't have anyone being inserted in between the physician and the patient.
So basically what the physician says is what gets covered.
Correct. With traditional Medicare, your physician not only your rheumatologist, but the physicians that you choose to work with, that when they write a prescription, that's it. With Medicare Disadvantage, you write a prescription and they're like, oh, no, we know better. We know better. For this diagnosis of rheumatoid arthritis, you have to go through this one, this one, this one, this one before you get to say, before Dr. Bach or any physician wants to let them do what they want. So the denials are huge. The narrow networks, I mean, they funnel patients into fewer and far between rheumatologists. There's one Medicare Disadvantage plan that we terminated our contract with. We actually terminated our contract with Cigna last year. And then there's another plan called Essence Medicare Advantage. We terminated that in May of this year because they were making our office prior authorized an $11 medicine. You could buy it for $11 with cash, but they think so little of the physician's time and clinical decisions that they put all these burdens of paperwork. 7 pages of questions for one patient for an $11 drug. It's a colossal waste of doctors' time.
Absolutely, and yours as well.
Right. So
how has using the power of Twitter been able to help you advocate for your patients? Because that's how you and I got connected.
Yes. So after we do all of our normal channels of appeals, we get with our patient, and if they want us to advocate with them, they need to stand shoulder to shoulder with us, and we redact the case and we post it on Twitter. We send it out to the insurance company, the pharmacy benefit manager, and the employer if it's a commercial plan, and it's just basic public shaming. Public shaming works in 2024. And we now have all sorts of other social media because I have my social media manager, Claudia, with me, and she's actually gotten on TikTok, and we have 17,000 followers on our TikTok channel. One of them is Mark Cuban.
Wow.
And Mark Cuban only follows 109 people.
Oh, I love it.
Yeah. So we're just carrying the message. And we, it's not without, pitfalls. We got a little cease and desist letter from Cigna. Now, come on, Marianne. Cigna, a multi-billion-dollar international company, is worried about my little rinky-dink office in Bridgeton, Missouri. We're doing something right.
And your little TikTok channel.
Yeah.
I love that. That means that they are nervous because if your office and then other doctors find out about what's working, there could be a tsunami.
We are looking
Absolutely.
to start a tsunami, and what you've done in New York is the same thing. You've had a tsunami because now that you've had all these wins, it needs to go nationwide with all the other unions and all the other working people. Social media gives working people a voice against their own insurance company because they want nothing more to just hide behind, oh, your doctor didn't do this. Oh, no, it's not us, it's your doctor. It's not your doctor, it's the insurance company.
Oh, we were just having this conversation about another, that we could talk case studies forever because I think every listener in the area and beyond has had an experience, maybe not specifically on Medicare Disadvantage, but with their insurance company of being denied and having terrible things happen or knowing somebody that's happened to. So yeah, this is great that the work that you're doing and the pressure that you're putting on this for-profit system. Our call-in number, by the way, is 212-209-2877. I think we have some callers on the air. Let's get a caller in and see if we can answer or give feedback to the question or comment. Caller, your name and where you're calling from, please.
Daryl McPherson from New York.
Hi, Daryl. Thanks for the call. What would you like to say today?
First of all, I want to welcome you back. And I hope your child is doing well, because that's why we have to give you up for a while.
Thank you.
Listeners, we need like $500 for the show, and we need another $200 for the phone system that isn't working. Let's go into our pockets, talk to our neighbors, and listen to Juliana, and B, come up with some money. Now, I'm totally against. No, forget what I'm against. I'm totally for doing away with all insurance and having a full single-payer system. One, most people, have zero clue because of their experience.
experiences being on the planet about what that would mean. Second of all, why are we limiting the practitioners that are acceptable when a lot of those practitioners have treatments that work as compared to maintenance? You can go into a doctor and they'll tell you have diabetes for life and you have to take XXXXX and you may get managed. Or you can go into another doctor and they'll say, if you follow what I tell you to do, in a month, your insulin will be regulated and you can go on live your life at a better rate. We're failing to, because of the bells and whistles, especially on the Advantage plan, we're failing to reach the population that is totally ignorant about the difference between having somebody do something and have people working with you to understand how your body works and what's in your best interest. We've been working, people in the United States of America have been working against themselves, I think, since the beginning. And this is our opportunity. This is our opportunity to turn it around. One of the quote-unquote advantages of the Advantage plan is that they cover ears and eyes and what kind of
until they let you die. Daryl, you're making a lot of excellent points here. I want to let our guests respond to some of the points you're making about preventative medicine and about different kinds of medicine not being covered at all, even under these plans. So thanks for the call. I appreciate it. I'm sorry to cut you off because you were making a lot of good points, but I do want to let the guests respond. Kay or Marianne, any response to the kind of few things that Daryl was bringing up there?
Julie. Julie,
sorry, Julie. I went back a half an hour. Yes,
it's all good. So I appreciate Daryl's questions and comments. Look, these union people and all Americans, we're all patients. So we all have that in common, and we've all been denied and delayed by our insurance company. Everybody has those two things in common. And so if you want access to physicians, you can't burn them out with these Medicare Disadvantage administrative burdens, which are nonsense with the prior authorizations. And we all need access to care. And if you've already paid for it, you've paid your premium, and your insurance company, if you end up in a Medicare Disadvantage program, they want you to pay more. So these high deductibles, in my world, my patients don't have $2,900 every January to come out of pocket with their Medicare Disadvantage plan. So they go without medicine. So if you want access to good quality physicians, you better not choose Medicare Disadvantage because it's a narrow network and they just put barriers in front of patients. You need choice. You need a choice.
And you also remember too that even though for some of those preventative type, like he mentioned, eyeglass or dental, that they're not comprehensive and that they are truly, it's a perk that's at the expense of the direct access to specialty providers that would have accepted or treated you for specialty care like your rheumatology issues or cancer. And those are doctors that don't want to take these plans. So you're taking a perk at the expense of direct access to medical care.
Yeah.
Medicare for All seems like it is the kind of thing that, it's going to be a long haul and lots of work. You never know. Sometimes things just happen and change happens quickly. But it seems like there has to be enough people who've been hurt by Medicare Disadvantage to have some sort of class action suit against what they are doing. Is there legal action against what they're doing possible? Or is it happening?
Well, I think that would be a better question for Marianne and her team of lawyers to answer. I'm not a lawyer, but I can tell you I'm sitting here with harmed patients that have Medicare Disadvantage. It's so skewed and it's so unfair to the patients because even the insurance agents that sell this, they're getting paid, I think it's like $600 to sign up someone for a Medicare Disadvantage plan, and they make like $110 to sign up someone for traditional Medicare and a supplemental plan. So when you have that sort of bias and that carrot going into it, they're going to tell you whatever they need to because they're working to support their own families.
Make their commission.
And for a rheumatology patient, if you get bamboozled into a Medicare Disadvantage plan, you won't be able to switch back to traditional Medicare and a supplemental plan because you'll never make it through underwriting. And so therefore, that one choice of, the shoehorn that says United Healthcare's logo on it, for that little, prize, some 3-cent thing, you have traded in all your benefits, all your choices.
Yes.
We're speaking with Julie Bach, who runs her husband Steve's St. Louis, Missouri-based rheumatology practice and is also a healthcare consumer advocate that does battle with Medicare Advantage plans every day. Julie, thank you so much for being here with us. Our phone number is 212-209-2877, 212-209-2877. If you'd like to call, ask a question, make a comment, we are open for that. We do have another caller on the line, so let's go to the caller. Caller, you're on the air on WBAI. Your name and where you're calling from.
Hi, good morning. My name is Angel. I'm from New York City, and I'm a New York City retiree, and Marianne is a badass. I've been on the front lines with her. We've been part of a die-in, et cetera, et cetera. I'm part of a group called Radical Elders, and with members of the People's Forum. We've had forums on this. And one of the things that's challenging is the unions. Even now, even though the retirees have won 9 times in court, Mayor Adams just recently is appealing the most recent decision, which is horrible, that he's doing that. And also the unions themselves that cut side deals for the Medicare Disadvantage programs. 94% in Puerto Rico, for example, of people are Medicare Disadvantage. So they're already, what's happening is we're tipping the balance now, I think, a bit, because even though there's over 50%, more than maybe 52, whatever, are Medicare Disadvantage, people are finding out how they overcharge. What I want to ask Marianne is, when you went to D.C., I know 19 doctors are in Congress, and none of them support single payer. What kind of health plan do they have? Because maybe I want to have what they have. Thank you very much for all your struggles. And Julianne, welcome back.
That's a really great question.
Go ahead, Marianne.
That's a great question. They probably have congressional health care.
All paid for on the backs of the taxpayers. Trust and believe all the legislators have great health care because they don't want anything to do with Medicare Disadvantage. It's way more expensive, as we all know, to care for patients because they have to skim off and siphon off direct patient healthcare dollars away from the patient and into the insurance company's pockets. So I actually am a little bit on the fence about Medicare for All. I wouldn't mind Medicare for All as long as it's not United Health Cartel, because trust and believe that they have integrated themselves into Medicare and CMS so heavily that they are seen as like the answer. So we have to be careful what we wish for. If we have Medicare for All, it should not be run by one of the existing insurance companies. It needs to be run by people like that badass Marianne, and I would stand shoulder to shoulder with her to run it.
Well, thank you, Julie. And one of the other things that the caller had mentioned, was about the Medicare Advantage plan. We did have an announcement last Sunday where the United Federation of Teachers withdrew their support for the Medicare Advantage plan that was being forced down our throats by the mayor and the umbrella organization of the Municipal Labor Committee. So it is getting some legs and people walking back their support, and there's a myriad of reasons, and I'm sure we can go into that in another show when we have more time. But I had one more question for you, Julie. You had a very special guest this week, and someone who's been on the national fight with this. You want to share a moment or two about that?
Absolutely. We had Wendell Potter here last week for a few days, and he did some patient interviews and was in my clinic. And we also had some really great people from Get Claimable here. And what we have found is that when patients make an appeal, the insurance company has to stand up and listen to it. When a physician's office makes an appeal, they're like, we don't care about you. You're an independent contractor. We don't have to get back to you. So Wendell is doing a piece, and we're working with him on patients' rights. everybody's a patient, and patients have rights, and the insurance company is hoping that people don't realize that. I told you that 1% of physicians appeal the insurance denials, 0.1% of patients appeal it. So it's like this little sliver, okay? So if we can bring national level attention with Wendell Potter, who is he's a whistleblower and ex-Cigna leadership. He calls himself a chief propaganda officer at the insurance company. That's what his title was, like VP of communications. But if Wendell is on the good side and Wendell wants to do right, Wendell was in my office in Bridgeton, Missouri, talking to my patients. We are going to share these stories, and they are going to make an impact, because insurance companies have inserted themselves in between the patient and the physician, and it must stop. So very excited to have Wendell Potter. He's actually going to come back in our office in July, and more to come on all of this.
Thank you so much, Julie, for being here with us. How can people find and follow you on social media?
Sure. So you can go to Arthritis STL is our Twitter handle, and we also have a website, which is www.drbach.com, and that's D-R-B as in boy, A apple, K kite.com. We're just here trying to do everything we can to support patients.
And our TikTok is C_money.
Thank you so much for the work that you're doing.
Claudia wanted to give our TikTok really quick. Okay.
Absolutely.
All right. Give the TikTok.
Thank you. It's C_money 636.
So we have to use her 8th grade one because of Cigna. C_money 636 on TikTok.
I love that. It's hysterical. Okay, more on that later.
That's great. And I'll share you. Don't worry. I'll always retweet you, reshare. Don't worry.
Thank you.
This is terrific. Thank you so much for the work that you're doing on behalf of all Americans. Julie Bach, running Stevens, her husband, St. Louis, Missouri-based rheumatology practice, and a healthcare consumer advocate doing battle with Medicare Advantage plans every day. Of course, we also had, that's it. Can you believe it? We're almost done. That's the end of the program. That flew by. Of course, I've been joined, as per usual, by Mary Ann Pizzatola, retired FDNY EMT and president of the New York City Organization of Public Service Retirees. It is always a joy and pleasure to spend time with you, Mary Ann. Can you come back next Friday, please?
Absolutely, Juliana. To be with you, no problem.
Just keep coming back until this whole thing is fixed, right? Can I get that?
I think we're going to be here a while.
Well, you can do it. All right. If you like this program and want more like it, go to WBAI.org, and please become a WBAI buddy. Tune in at 7 a.m. for Bob Henley's Labor Monday edition of What's Going On. Democracy Now! Is up next. Thanks so much for listening, and have a beautiful, beautiful day.
Thank you.
Bye, Julie.
Thank you.
You're welcome.
I guess.
You don't want to tell them about what you just said?
Huh?
You don't want to tell them about what you just said? Or are they getting back on the phone with you? So.
Okay. So.
Julie, that was her on the radio. They did keep messing up the names, but it's okay.
Well, one of the hosts is named Juliana.
Oh,
and then
okay.
Mary Ann Pizzola is the badass from New York City who's driven this change against Medicare Disadvantage. And I love that they're on the radio caring for their union members and their union brothers and sisters, because that is what it takes in 2024 to get access to quality health care. Your insurance company and your Medicare Disadvantage is not looking for you to have health care. They're looking for you to have delay and denial care and to be funneled into one size fits all in their narrow networks. We're not here for that, and neither is Mary Ann Pizzola.
What was the thing we saw yesterday? It's healthcare shouldn't. We had a couple good quotes.
Yeah, we
should
did.
have printed them out.
Well, actually, I think I have a screenshot of it. Maybe I took that and sent it to. Because healthcare shouldn't be denied. Fight with us.
I like that a lot.
I do
I
too.
might put that on our website.
And we stand together with patients who are tired of being bullied by their insurance companies. Take action, stand with your patient, overturn your insurance denial. That's what we're doing. That's what we're all about. Yay.
All right, we'll see you later.
Bye, everyone.
Hope you had a safe 4th.